Chapter 1. Health Better. 5 medical tests seniors should rethink after 70. If you're over 70, your doctor probably still recommends regular checkups, but what if some of them are no longer helpful, or even risky? In today's video, we'll uncover 5 common medical tests that seniors are told to get, but experts now say may do more harm than good. You'll learn which tests can lead to dangerous treatments, why some screenings are unnecessary after 70, and what smarter health choices you can make instead. Let's dive into the truth about aging and medical testing, because better health doesn't always mean more tests. First up, the PSA test for prostate cancer. Many men over 70 still get this test, but research shows it often leads to false positives, unnecessary biopsies, and even treatment for slow-growing tumors that never would have caused harm. According to the U.S. Preventive Services Task Force, PSA screening is not recommended after age 70 unless you're at high risk. Why? Because the risks, urinary incontinence, sexual dysfunction, and surgical complications, can be worse than the cancer itself in older men. Talk to your doctor about whether this test still makes sense for you. Next, routine colonoscopies. Colon cancer screening is essential between ages 50 and 75. But after that, the benefits drop fast, and the risks rise. Older adults have higher chances of bleeding, bowel tears, and anesthesia complications. The prep for the test can cause dehydration and electrolyte imbalances. Experts suggest switching to less invasive options, like the FIT test or skipping altogether if you're not high risk and have had clear results. Remember, screening is about benefit versus harm. After 75, the scales may tip. Ladies, this one's for you. Pap smears and HPV tests after age 65. If you've had normal results for the last 10 years and no history of cervical cancer, continuing these tests is often unnecessary. Why? Because cervical cancer is very slow growing, and new cases after 65 in low-risk women are extremely rare. Yet many women are still routinely screened well into their 70s or 80s. This leads to false positives, anxiety, and sometimes unneeded procedures. Clipboard. The American Cancer Society recommends stopping if your records are clean. Check your history before agreeing to another test. Full body scans sound appealing, right? A full check to see if anything is wrong. But here's the truth. These tests, especially CT scans, are often done without symptoms, and they expose you to high levels of radiation. Often find incidentalomas, small nodules or masses that are benign but trigger unnecessary biopsies, surgery, and worry. Unless your doctor is looking for something specific, a full-body scan may cause more confusion than clarity. Bullseye. Focus on targeted testing, not blanket scanning. Better health isn't about chasing shadows, it's about wise choices. Finally, bone scans. Yes, bone density testing is crucial, especially for women over 65. But here's what most people don't know. Bone density changes very slowly. Annual scans rarely show significant difference. In fact, most experts recommend doing a baseline DEXA in your late 60s, and only retesting every 2 to 5 years, depending on your risk factors. Overscanning often leads to overmedication, including drugs with serious side effects like jaw necrosis or femur fractures. Beach balloon. Ask, has my health status changed? Is this scan necessary this year? Be an advocate for your own bones. So what should you do to keep your health better after 70? Checkmark. Focus on healthy lifestyle, movement, nutrition, hydration, and sleep. Personalized care. Not every test fits every person. Open conversations. Ask your doctor why a test is recommended. Woman health. Worker medicine is evolving. You don't need to say yes to every scan or screen just because it's routine. Warning. The real power comes from informed decisions, knowing what helps, what harms, and what's just habit. If this video helped, hit like, share with someone over 70, and drop a comment on what surprised you most. Stay smart, stay strong, stay informed, and keep your health better. Chapter 2. As a brain doctor, I've seen firsthand how well-meaning checkups can sometimes go wrong, especially in seniors. Today, I'm pulling back the curtain on 7 medical tests that may do more harm than good after age 60, and yes, some are linked to blood clots, confusion, and even strokes. You'll hear why I'm urging my own patients to stop blindly accepting routine tests, and what safer, smarter alternatives exist. Let's explore the real risks, the data. This test sounds high-tech and precise, a CT angiogram to scan blood vessels in your brain. But here's what many don't realize. It uses iodine-based contrast dye, which can damage kidneys. It may trigger blood clots or brain bleeds, especially in older adults with fragile vessels. Many patients get these scans after mild headaches or dizziness, without any sign of stroke. That's when it becomes unnecessary risk. Brain, if you're not showing stroke symptoms, always ask, do I really need this test, or is it being done just to rule things out? Some clinics offer carotid artery Doppler ultrasounds to screen for stroke risk. But routine screening in healthy seniors without symptoms often leads to overdiagnosis of minor narrowing. Fear-based surgery, like carotid endarterectomy, increased risk of stroke or blood clots during or after the procedure. According to the American Stroke Association, only patients with symptoms like TIA or known artery disease should be scanned. Otherwise, this helpful test may push you into risky procedures you don't need. Core calcium scoring is popular among seniors trying to check their heart. But here's the catch, the radiation is higher than most scans. The test doesn't predict your actual risk of heart attack. Many end up on unnecessary blood thinners that can cause, yes, blood clots. If you already have a diagnosis of heart disease, or are over 70 with no symptoms, this test may not add value. Ask your doctor about functional heart testing instead, like an echocardiogram or exercise tolerance test. This one hurts me to say as a brain doctor, but I've seen it too often. Seniors come in with mild forgetfulness or headaches, and doctors order an MRI, just in case. The problem, MRIs often find incidental brain lesions that are harmless. This leads to panic, biopsies, even brain surgery. A Harvard study found that nearly 30% of older patients with normal MRIs still got treated for harmless spots. My rule, if you're still functioning well and have no progressive symptoms, don't scan just to scan. This test is often done for peace of mind. But here's the truth, in older adults, stress tests without symptoms have a high rate of false positives. That means unneeded stents, dangerous blood thinners, risk of blood clots or internal bleeding. According to the American College of Cardiology, stress tests should only be used when chest pain, shortness of breath, or real risk factors exist. Be cautious with over-testing the heart, you could end up treating something you don't have. Chest X-rays used to be standard in yearly checkups. But did you know, they detect false shadows, lead to lung biopsies and exploratory surgery, and often miss early-stage lung cancer anyway. For healthy seniors, annual chest X-rays are not recommended. If you're not a smoker, and you don't have a respiratory history, you're better off skipping this one. Focus instead on breath tests, pulse oximetry, and physical function. Those tell you far more. Checking blood pressure is important, but doing it the wrong way can do more harm than good. Wrist cuffs give inaccurate readings. Daily monitoring increases anxiety. People adjust meds too quickly, causing drops, right-pointing arrow dizziness, right-pointing arrow falls. My advice, use upper arm cuffs only. Measure 2 to 3 times per week, not every day. Focus on trends, not individual spikes. Remember, stable pressure is more important than perfect pressure. So what's the answer? If you're 60, 70, or 80 plus, here's what really boosts your health. Checkmark functional tests. Can you walk 6 minutes? Get out of a chair without help. Checkmark cognitive check-ins. Do you forget conversations, or just names? Checkmark lifestyle markers, energy levels, sleep, mood, mobility. Clipboard tests don't always equal truth. Over-testing leads to over-treatment, which leads to over-complication. As a brain doctor, I urge you, stop agreeing to every test. Ask what's the benefit, what's the risk, what happens next. Bullseye. Let's make health better, with wisdom, not fear. Right finger like, share, and comment if this gave you clarity. And subscribe for more trusted health advice, backed by science, and delivered with care.